Dr. Amish Adoja is a physician who has been tracking the COVID crisis since day one. We go back almost, I think, 3 years. He's been a frequent guest on our show. Dr. Adoja, first of all, let's put this in perspective. How surprising do you find this uptick in cases?
It's not surprising at all. We've seen it the last 3 summers. As it gets hotter, people start to move indoors into air conditioning, and we know that indoor transmission is something that accentuates with this virus. And you have to remember, this virus is not going anywhere. It's an endemic respiratory virus. It's always going to be with us, and we're going to see ups and downs. But what we don't see are hospitals in crisis, which is a testament to the technology that we have in terms of the vaccines and antivirals.
Dr. Adoja, as I mentioned, you and me have been on this now for quite some time. But let's go back to the beginning when we saw those cases in upstate Washington, 32 cases, I believe, and that led to what we then wound up living through. Why is this different? Is this the same virus that we started out with, or is it less severe? In other words, why do you see 8,000 cases and say, don't worry, but we saw 32 and it was time to shut the government down?
It's because we're different. We are now a population where 96% of us have evidence of either infection or vaccination or both. So we're a much more experienced population, and that really delimits the ability of this virus to cause severe disease or to inundate a hospital the way it once could. The virus has changed. It's not the same virus, but what's bigger, I think, is our immunity is so much more robust than it was. So this is not a crisis or anywhere near a crisis because of the immunity that's in the population.
But if this virus has proven anything, it is that it is adaptable. All I have to do is mention the Omicron variant. How concerned should we be that this could lead to a bigger outbreak?
I think what we're already seeing is plateauing. If you look at wastewater data, where they look at the sewage systems in cities, we're already seeing this plateau. So we may be not getting even as big of a summer rise as we had in prior years. So I don't necessarily think this is going to turn into something that's anywhere near what we were used to with COVID-19. And yes, we're going to get new variants. It's not the end of evolution with this virus, but what we increasingly see is the virus constrained because of the immunity, because of drugs like Paxlovid, which decrease hospitalization by 90%. So this is a much more resilient population that the virus is coping with.
Dr. Adoja, there is someone sitting out there right now saying, I didn't get the vaccine when it was roaring through the population and I'm fine now. Should I get a vaccine now? Or if I have had my vaccine, is it time to get a booster shot?
It all depends on the person. We know that COVID doesn't treat people equally. There are people that are low risk and high risk. Certainly high risk people need to be very careful. They need to be up to date with their vaccines. Lower risk people, many of them have probably already gotten COVID, so they have some level of immunity. But in general, vaccination does provide durable immunity against severe disease, and it's really essential if you're in any high risk group, including being overweight or obese, that you get vaccinated and stay up to date, because that's who constitutes the majority of the COVID hospitalizations and deaths that we still see today.
Now let's go to the nightmare that you lived through, mask. We're going to theaters right now. I was just in the movie theater seeing Oppenheimer, loved it, sitting around a bunch of people, flying on planes again. Is it time for us to start wearing masks?
This all depends on individual risk tolerance. You have to assume that anytime you socially interact with anyone, anywhere, that there's some risk of COVID and other respiratory viruses. Masks are a tool that decrease the risk of COVID, but it's one tool out of many, and each person really has to decide. Again, if you're in a high-risk group, if you're someone that's had an organ transplant, a bone marrow transplant, very elderly, you should think about masking in congregated, crowded areas. But for other people, I think they have to kind of see where that fits into how much they're trying to avoid COVID, which will likely be a mild illness for them. So it's, again, something about risk tolerance and learning how to risk calculate with the virus that's always going to be with us now and 50 years from now.
Dr. Adoja, final question before I let you go, and I've only got 30 seconds, but if history proved anything, it was that we were not ready for COVID. Are we better prepared for what could be the next pandemic coming our way?
I think we're better than we were before COVID-19, but we're nowhere near as prepared as we need to be. One just has to look at the Mpox outbreak that occurred that people have now forgotten about to see all those same missteps kind of replay themselves. We do have an opportunity now to get this right. There is legislation in Congress that needs to be passed that would fortify our ability and really put us on a stronger footing, a proactive approach, so that we don't have kind of a reactive approach that led us to the problems that we had with COVID. But that really depends on politicians, and that's the big wild card.
Dr. Amish Adoja, good to see you again. Thanks for joining us.
Thank you.
And a